Now let's go to the contraindications of chemotherapy. Actually, there are several. So the first is infection. So, hindi pwedeng magbigay ng chemotherapy sa mga pasyente na merong infection. You have to remember that anti-tumor drugs are immunosuppressives. So, kung bibigyan siya ng chemotherapy at mababa ang WBC, immunodeficient ang pasyente, and then may existing infection, ano na lang ang mangyayari sa pasyente? Pwedeng magkaroon yan ng sepsis. Okay? Pwedeng magkaroon yan ng pagkamatay pwedeng maging mamatay ang pasyente natin. Okay. Next, recent surgery. Chemotherapeutic drugs can retard or can slow down the healing process. So, bawal mag-chemo kapag nagkaroon ng recent surgery, lalo na pag hindi pa magaling yung opening. Next is impaired renal or hepatic function. May mga drugs tayo na nabanggit ko kanina that are renal toxic and hepatotoxic. That is why kung impaired na itong mga internal organs na ito, might as well hindi na lang ibigay yung chemotherapy kasi baka further aggravate pa yung decreased function ng kidneys and liver. Next is recent radiation therapy. Radiation therapy is also immunosuppressive plus dadagdagan pa ng chemotherapy which is another immunosuppressive. Ano na lang nangyari sa pasyente natin? Mga buntis, no? Bawal pong mag-chemotherapy ang mga buntis because chemotherapeutic drugs may cause congenital defects. And lastly, if the patient has the underlying problem that is bone marrow depression, because the chemotherapeutic drugs can aggravate the situation, the condition, before any chemotherapy, the WBC level must be within normal limits. Kasi nga po, isa nga po sa fatal o maaaring ikamatay ng pasyente ay ang mababang WBC because of the risk of infection. And for our last topic, here are the safe handling of chemotherapeutic agent. So let me read the following bullets to you guys. As nurse, you have to wear mask, eye shield, gloves, and back closing gown. Skin contact with drugs must be washed immediately with soap and water. May mga chemotherapeutic drugs tayo that could be contracted topically. So pagka nailagay sa skin natin yan, we have to wash out immediately. Eyes must be flushed immediately with copious amount of water. Sterile/alcohol wet cotton pledgets should be used, wrapped around the neck of the ampule or vial when breaking and withdrawing the drug. Because that will be your shield. No? Maaari kasing mag-leak po doon yun. So, saan mapupunta yung leakage? Doon po sa cotton balls. Expel air bubbles on wet cotton. Ang tendency kasi mga anak, kapag ka po iyan wet, mas madaling mag-absorb yan. Pagbasa na po yung cotton, unlike yung dry cotton. That's why, para mas masigurado na maa-absorb yun ng cotton at hindi mapupunta yan sa sayo as a nurse na nagpe-prepare, wet cotton ang gagamitin natin. Vent vials to reduce internal pressure after mixing. Wipe external surface of syringe and IV bottles. Avoid self-inoculation by needle stab. Clearly label the hanging IV bottle with anti-neoplastic chemotherapy. Contaminated needles and syringes must be disposed in a clearly marked special container. It should be leak-proof and it should be puncture-proof. Dispose half-empty ampules, vials, IV bottles by putting into plastic bag, seal, and then into another plastic bag or box clearly marked before placing for removal. Label as hazardous waste. Lastly, hand washing should be done before and after removal of the gloves only trained personnel should be involved in the use of drugs. Preferably, they are chemotherapy certified nurses. Ideally, preparation of chemotherapeutic drugs should be in laminar flow conditions with filtered air to prevent contamination with microorganisms. So those are the safe handling techniques of chemotherapeutic agents. And that ends our discussion. Joke-joke lang. Meron pa po tayong tatlong tanong dito for our diploma at lisensya. So, tatlong tanong. Ang unang tanong po, pag nasagot mo to, may chance na maging kayo. While administering a chemotherapeutic agent, the nurse suspects extravasation at the client's IV site. Nagkaroon ng leakage, subcutaneous tissue, yung chemotherapeutic agent. The first nursing action is, ang nasa isip agad natin, vesicant ito. A, place ice over the infiltration site. B, stop the medication administration. C, administer antidote. D, apply warm compresses to the IV site. So, anong sagot mo? Siyempre, hindi ko sasabihin. Next. Pag nasagot mo to, magre-reply siya mamaya after mag-charge ng phone for 5 years. A client presents with mild stomatitis, so oral mucosa, may pamamaga sa oral mucosa, while undergoing chemotherapy. An appropriate nursing intervention is to rinse with mouthwash. Uy, parang may mga mouthwash tayo na alcohol-based Parang hindi pwede yon. 3 times a day. Use a soft toothbrush. Provide cold foods. Floss twice a day. So ano daw po ang tamang sagot dyan? Parang nabanggit ko ito kanina. Paano ang proper oral care? And lastly, Angela, a clinical instructor, is conducting a lecture about chemotherapy. Which of the following statement is correct about the rate of cell growth in relation to chemotherapy? Pag namali ka dito, tutuktukan kita. At pag nasagot mo to, bigyan kitang candy. Pochi. A. Faster growing cells are more susceptible to chemotherapy. B. Faster growing cells are less susceptible to chemotherapy. C. Slower growing cells are more susceptible to chemotherapy. D. Non-dividing cells are more susceptible to chemotherapy. So, I hope alam mo yung sagot dyan at malinaw sa'yo yung sagot dyan. So, dito na po talaga ang end ng discussion natin. For the next week, it will be asynchronous. And may readings lang po kayo. Madali naman pong intindihin yon. So, I hope malinaw po ang lahat. If there's any question, you can message me or you can type dun sa ating Google Classroom. Bye-bye na po. End na po ito.